CataractCoach.com. Surgeon and patient communication. This is a critical subject that we really should study in detail.
In ophthalmology, it's important to have mentors. We want a surgical mentor to teach us things in the operating room so we can learn new techniques, rescue us from a difficult case, even sometimes hold our hands. You can have a mentor that you learn from with surgical videos from across the world. But surgical learning is one part. There's also learning in the clinic. Of course, it's the diagnosis and treatment of ocular diseases, but also the patient-physician interaction, how to talk to patients. In that regard, I want to tell you about a book that I just love. It's called What I Say. It's conversations that improve the physician-patient relationship. And the authors are Robert Osher, Bobby Osher, one of the pioneers in ophthalmology, and a young up-and-coming ophthalmologist, Jack Parker. And this book is fantastic. It's only about 100 pages, so it's an easy read, but it goes through topics that are so important. What if you have a patient who has Flomax? How do you talk to the patient ahead of time? What about patients with a posterior polar cataract? What are the implications there, and how should you educate the patient? What if there's a complication during surgery? How is that explained to the patient? So this book gives you the exact conversations that are used here to explain things to patients and improve that relationship you have with them. Now, Bobby Osher has been a mentor of mine for more than 20 years, and in his many decades of practice, he's learned so much, and it's really boiled down into this little book. I don't have any financial interest in this book. It's sold by Slack Incorporated, but I'm a huge fan. I think it's a fantastic book, and I highly recommend it to you. The bottom line for the book is setting appropriate patient expectations. So that means before surgery, explain to the patient what to expect afterwards with the results of surgery. And that may be complicated. The patient may have pre-existing conditions. And what if they're very myopic? You may have a higher risk of retinal detachment. What if there are things that increase the risk factors? Posterior polar cataract, small pupil, Flomax, really dense cataract, weakened zonules. So explaining that at a time. What if there are things that will limit the patient's post-op vision? You'll do a beautiful cataract surgery, a perfect surgery, but then the patient has a macular scar or an irregular cornea, and those are going to limit the patient's post-op visual recovery. So again, it's setting appropriate patient expectations. You want to have the results of your surgery at least meet, but hopefully exceed the patient's expectations. And if you can exceed those expectations, the patients are basically going to be very happy. You also have to be able to temper patient expectations. Patients have very lofty expectations. You have to bring them back down to reality so that your results can at least match or even exceed what they're expecting from the surgery. So I encourage you to check out the book. Well worth getting, an easy read, and I bet you'll learn a whole lot from it. Thanks for watching.